Now, I said earlier that we really need to start thinking about putting the customer at the center of all we do. And if that's the case, then I think it's important that we ask them what they want from pharmaceutical companies. Now, interestingly, in this survey of 2,800 healthcare professionals, medical education, educational content, and new clinical data were the top 3 types of information that they wanted to get from pharma. Yet, perhaps not unsurprisingly, the majority of information they receive is promotional information. So I think access to high quality education is really crucial for healthcare professionals, but it is harder for them to come by than maybe you'd think. For example, we were looking at a project last year in vaccines where we interviewed lots of primary care nurses and GPs, and across the board, they were telling us they were desperate for access to high quality and free education. Now, of course, traditionally pharma's delivered that education through live events, but I have seen an increasing number of companies now looking at on-demand e-learning as a way of upskilling healthcare professionals on the diseases in which their drugs are used. Traditionally, I think pharma's delivered its e-learning content through third parties, usually medical publishers. And I can see a lot of sense in that, in that taking your content out to where healthcare professionals are, to use an old marketing phrase, you fish where the fish are. But I think the problem is that working in that way, the publishers are the ones that own that relationship and therefore own the access to the customer. And I believe that the age is now upon us where it's time for pharma to start building its own communities, to start having rich, long-term relationships with their customers. In this case study here, which is a platform built by Takeda in Europe, and they've done just that with this particular platform. They deliver e-learning, they manage all of their live event registrations, they deliver webinars, and they also even host closed groups within this platform. So for example, if they have an ad board, they can invite all the members of the ad board to the group, and then they can share files and have conversations on the platform. So every interaction that the healthcare professional has with Takeda in an educational capacity flows through this platform, and that allows them to build up strong relationships over time and generate permissions for other marketing opportunities outside of the platform. Of course, I think third-party publishers will continue to have an important role to play, but for me, instead of hosting content, their role will be more as a channel to direct users to pharma's own solutions. Now, it goes without saying that unless the content is great, healthcare professionals aren't going to want to engage with it. So here's my vision for pharma content nirvana. So what I'd love to see is less static, boring slides and much more interactive, engaging content. I'd like to see presentations being less wordy and much more audiovisual. I'm thinking video and I'm thinking podcasts. I'd like to see content that's less designed for the desktop and more designed for consumption on the move. So imagine healthcare professionals asking Alexa to play them the latest keynote speaker on their commute to work. I'd like to see content that's less one size fits all for the masses and much more about personalized and tailored content to individuals' interests. I'd like to see pharma move away from delivering hours and hours of monotonous presentations and instead delivering more short, sharp, bite-sized snippets of learning, which studies suggest is actually really effective. And finally, I think our content needs to be less about the pharma company view and much more about independent expert opinion from thought leaders and innovators.